I'm Jeffrey, I'm going to be your nurse today.
Okay.
We're going to be doing your head to toe assessment. So I'm going to close the curtain here and I'll wash my hands.
Okay.
Get some gloves. Are you in any pain today?
No.
Let's check your, verify your name and date of birth.
Arlene St. Louis, 052593.
Okay. So no pain today. Now we're gonna check your vitals. So I'm gonna do your blood pressure, your pulse ox, respirations, your temperature, and you said no pain.
No pain.
Okay. Now I'll make sure that you're alert and oriented.
Okay.
All right. Do you know where you are?
Yes, NSU Hospital.
Okay. And you know what today is?
Yes, April 7th, 2023, oh my God,
Yes.
2023.
And you know why you're here today?
For my head to toe assessment.
Okay. Next I'll do the skin assessment. So I'll check your fingernails here. And I check your head, checking your scalp, your hair, make sure there's no breakdown or anything. Your face, behind your ears. Okay. Everything is symmetric and normal-phatic. Now I would check your sinuses. So the frontal sinus here, the maxillary here, and then the jaw. That's checking for cervical nerve 5. So that's what I check there. Now I'm gonna check cervical nerve 7. And the facial nerve. So I check for facial symmetry. Raise your eyebrows, okay? And close your eyes, all right? And smile, and pucker your lips, okay. Now everything is normal. I check your eyes. The sclera is white, and there's the pink in the corner, and your eyelashes are intact. All right, now I'll check cervical nerve number 2. So I have a board over here. Can you just read the last 3 letters?
AWZ.
Okay. And then let me check nerve number 3. This is the oculomotor nerve. And let's see. Now let me get my flashlights. Alright. Let me check each eye and make sure they dilate when they're supposed to. Okay. Alright. Alright, now you need to focus on the end of the flashlight. So clockwise. Okay. And let's see what else. Everything was equal and reactive. Now I'm gonna check your nose, mouth, and throat.
Okay.
So I'll check inside the nostrils, make sure there's nothing obstructing, no drainage. Check cervical nerve number 1. So I have a smell here. So just tell me what you smell.
Vanilla.
And this side.
Vanilla.
Okay. Now let's check the mouth. Color and moisture is good. No missing teeth. Let's check for cervical nerve number 12. Let's stick out your tongue and say ah. All right. So everything was midline. Your uvula was midline. The tongue. Let's check the cervical nerve number 9 and 10. Well, yeah, I just did that. Now I'm gonna check the lymph nodes in the neck. So first I check the pre-auricular, post-auricular, occipital, the submental here, submandibular, the superficial cervical, the deep cervical, posterior cervical, and supraclavicular. Alright, everything is normal. Let's check cervical nerve number 11. Can you raise your shoulders and then put them down? And then do the same thing, raise them and then put them down. Now let's turn your head this way, turn it this way. Okay. I'm going to palpate your neck for tracheal shift. The sternal notch, everything's symmetrical. And I check for the distension in the jugular vein. Okay. Now let's palpate the carotid pulse. Let me get my stethoscope. I'm gonna check for bruits with the bell. So inhale and then exhale and then hold your breath. Yes, so I'm gonna check in the jaw, the midclavicular, and the base of the neck, and for both sides. Okay. Now we're gonna check for the respiration. I'm not gonna do the front because there's no chaperone for us. So I'll check through the back. Can you stand up here? Turn this way, that way. So I would check for the symmetrical, so take a deep breath. Okay, and one again. All right, now I'll do some percussion here. So check up here, this side, then down the sides. Okay, and now I did the same thing with the stethoscope, make sure I don't hear anything unusual. Okay. Now we're going to check the cardiovascular. So I would check chest wall, PMI. I do palpation, but I'm not going to do that. I can check your cap refills, make sure everything is normal. Your pulses. Now do the auscultation. So I would do, everything's in the front. So I'll check the aortic, which is the second intercostal space on the right. Pulmonic is the second intercostal on the left. Tricuspid is the fourth space. And then the mitral is the fifth space. And this one I would listen for 60 seconds. Then I'll check the genital urinary. Do you know your last bowel movement when it was?
This morning.
Okay. And any pain or tenderness?
No.
And then the same thing for the last time you voided?
2 hours ago.
Okay. No pain or tenderness?
No.
Okay. Let's check the muscular skeletal, so your range of motion. So let's do your abduction away, all right, and adduction together. Flex your arms, extend, elevate, and depress, and hand grasp, okay? Everything's normal, and let's check neurological. I'm gonna trace a letter on your back, and just tell me what it is.
C.
C, okay? And then have a seat. I'm gonna close your eyes, I'm gonna put something in your hand, and just tell me if you can recognize it.
A pen?
Yes.
Okay.
So then that would be the end of the assessment. Now just give the patient the call light make sure the rails are up, lower the bed to the lowest setting. And if, do you need anything else, just press the button.
Okay.
And that's it.
Thank you.
Good one.